Welcome, everybody. We just couldn't be more excited to help you unlock the causes and treatments for children and adults who have autism and autistic spectrum disorders. I am here with my friend, Dr. Jerry Cartsinell, and we are going to be with you for 10 lessons to try to really understand this from the perspective of a child psychiatrist and a pediatrician, but also two doctors who've been at this for a very long time, and give you a very different perspective on how to evaluate and treat autistic spectrum disorders. Dr. Cartsinell is a pediatrician. He has deep experience in this field and has treated what really amounts to thousands of kids and adults who have this. He's a fellow of the American Academy of Pediatrics, specializes in the recovery, so note that word recovery, of neurodevelopmental, chronic neuroinflammatory diseases. You're going to learn all about that. And hormonal dysfunctions. He went to medical school at St. Louis University, completed his residency in pediatrics in the Air Force. I actually did mine in the Army, in psychiatry. And following Desert Storm, Dr. Cartsinell practiced general pediatrics for 10 years until his fourth boy was diagnosed with autism. He's a nationally recognized speaker, New York Times best-selling author, and he has presented his work around the world. I'm just so grateful for you to do this with me.
Pleasure to be here.
So just a little bit about me. I'm a psychiatrist, but also a child psychiatrist. As I said, I did my residency at Walter Reed in Washington, D.C., did my child psychiatry fellowship in Hawaii. And when we were doing our training, autism was a very small part of it because it was a very small part of the population. But around late 1980s, early 1990s, all of a sudden we saw this explosion. And we're going to talk about why that might be. But talk to us about why you care about this, why this particular topic is important to you.
Well, as you said, that in the 1970s, 1980s, the autism rate was about 1 in 10,000. And in fact, when I was doing my residency, we had one autistic child that I evaluated, and they said that this would be the only one I would probably see in my lifetime. They're just that rare. And I didn't think much of it. There was a very small section in our textbook of pediatrics on child psychoses, is what it was called, and it was autism, and that was it. Shortly after I started general pediatrics, I had a few other children on the spectrum that were in my clinic, but I didn't think that much of it until my fourth boy was diagnosed with autism. And my wife said, I better get on this and figure out how to fix this because, as most of you know, it's a very difficult problem to manage at home. So I started the road on uncovering treatment protocols for children on the spectrum with my own son. And then once that got out, then I got another, and then another. So half my day was spent seeing well babies, and the other half of my day was now seeing children on the autism spectrum, and then eventually it just turned the whole practice into taking care of children on the autism spectrum.
So how did your son, how did you begin to know something wasn't right?
Well, you know, as an expert, I guess, in child development, because that's what we're trained to be, what's normal and what's abnormal. We saw a child who was progressing normally, and this was my fourth boy. But then all of a sudden we saw language disappear. He stopped speaking. Eye contact was no longer there. He had great eye contact. He started becoming more irritable, having tantrums, screaming and yelling, not sleeping, became hyperactive, running around. And his stools changed. His stools became very loose and sandy and gritty. Much like I had seen with children with cystic fibrosis. And I started thinking, well, I wonder if he's having food sensitivities and maybe he needs some digestive enzymes. Then we removed gluten, and that was kind of a hard thing to do, 22 years ago, and dairy, and put him on a digestive enzyme that we used for cystic fibrosis back then, and his stools improved, and his behaviors improved. And I said, okay, so maybe there is something that you can do to modify this course, and it's not just something that's set, and you just have to deal with it.
And what age was he when he changed?
He started changing as we look back, probably around 16 months, and by the time he was 24 months, he was well into it. And I think at that point, that's when I really started taking the reins and saying, I got to figure this out. It's not going to get better. It's not a phase he's going through. This isn't just a normal boy regression. This is a serious problem that I had to wrap my head around.
And not all kids regress. Some you can tell from the start that there's a problem with development. One of the reasons I'm passionate about it is my granddaughter, Emmy, who's now 7, and she was born floppy, that she just had no muscle tone. And at 5 months, it really showed itself. She started having wicked seizures. In fact, one day she had 160 of them. And I remember the doctor wanted to put her on ACTH, which is $26,000 a dose. It's like, what's that? And has more side effects than you can imagine, including wiping out her immune system. And I'm like, well, why don't we try the ketogenic diet? And I remember the neurologist told me, oh, there's just no science behind that. At which point we broke up because I asked him if he knew how to read. There were over 70 studies at the time showing a cut seizure frequency by 50%. And for 6 years, she's been seizure-free on the ketogenic diet, but she still has language issues and social skills issues, and technically could also be considered on the autism spectrum. And that just highlights how variable this illness is. And, as a child psychiatrist, I think I saw one kid during my fellowship, not very many kids early in my private practice. We started Amen Clinics in 1989. And then all around, it was like 1993, 1994, I just started seeing more of them. And at that time, we'd already been scanning people. That's what we're sort of known here for at Amen Clinics, is using imaging to help us understand our patients. And right away, we saw they had smaller cerebellums, that became a hugely important part of our autistic spectrum disorder kids. Their frontal lobes work too hard, so that was sort of the classic autistic spectrum pattern. Hyperfrontal, frontal lobes work too hard. Low activity in their cerebellum, and often they look smaller, but not everybody, right? And I think you and I have shared, over 100 cases. Right. And we clearly showed it's just not one thing. Some are toxic, some are traumatic, some are overactive, some are underactive. Right. And if you don't look, how do you really know? And that's how Jerry and I became friends and colleagues. Right. But as we go through this course, we want you to know this information is deeply personal to us, and it's based on a lot of children. And then subsequently, these kids have grown up. Right. And as we really understand it, these kids often have parents who have traits of autism, which we'll talk about. And so clearly there's a genetic component to it. And I think, I don't know if your thoughts are the same as mine, I think of it as genetic vulnerabilities mixed with environmental triggers that cause the expression of this?
I agree. I think that the majority of children that I see are born normal, but at a stage a little bit later in life, some trigger or triggers come along, and the behaviors and the physiological and biological changes that we can modify start to occur, manifesting in what we call autism.
So let's talk about what's going to be in this course. We're going to start by talking about understanding autism. What are the primary symptoms? What's the history? Some of the comorbid features, what are the other illnesses that tend to go with it, like ADHD, obsessive compulsive disorder, Tourette's, intermittent explosive disorder. We'll talk a little bit about nonverbal learning disabilities and how to separate that from autism. And then subtyping autistic spectrum disorders with SPECT. What are the things we've seen on the brain imaging tools that we use here?
And then we're going to go into the biomedical approach, looking at things that may actually have been triggers that brought your child to the place that he or she is in currently. We'll think about genetics and what role some changes in genetics may play and what we might be able to do about that. And of course, the laboratory testing, the things that I like to look at that give me clinical clues on where I can go with specific treatment protocols.
Then we're going to talk about the gut-brain connection. It's so important. And it's not just important in autism. It's important for your everyday life. Your gut has 100 trillion bugs. It's somewhere between 3 and 5 pounds at any one time of bugs in your gut. When I told that to my daughter Chloe, she's like, ew.
That's right.
Ew. And I'm like, no. These are like your pets. And you have to feed them right. And they serve you. They make vitamins, they detoxify your system. They're incredibly important. And when your gut is not right, as you alluded to with your son, your brain's not right. There's this huge gut-brain connection that we're going to talk about.
From there, we'll move into talking a little bit about infections, and we'll talk about hormones and their impact on responses to stimuli, to behaviors. Hormones from the adrenal glands, the sex hormones that they may have. But there's other hormones like thyroid and growth hormone. We talk about cortisol. There are a lot of things that we can do with hormone modification that in these children might be too high or too low. And again, when the hormones aren't right, behaviors tend to be exhibited that we can actually modify.
And I can't tell you the number of teenage boys I've seen who have low testosterone levels. It's just insane. And, can happen from things like a head injury or the toxic exposure. We'll talk a little bit about some apps you can download, like Think Dirty. You begin to scan your personal products, and you see they're loaded with hormone disruptors. So how do you live in a way where you're not actually poisoning yourself and the people you love? We're then going to go into some of the biological and biomedical interventions, things like supplements and vitamins. I became a huge fan after I started looking at the brain because I realized some of the meds I was prescribing were toxic. And that really irritated me because I remember in medical school, you probably as well, first do no harm, use the least toxic, most effective medicine, treatments. And so I'm like, well, what about things like omega-3 fatty acids or St. John's wort or 5-HTP? And people go, oh, well, there's no science behind that. And again, I'll go, well, do you read? Because there actually is a very robust body of science there. We'll talk about some other treatments like neurofeedback. One of my favorite treatments is actually through neurofeedback. I started looking at the brain. It was 1988. I became a biofeedback therapist, and when I learned about it, teach people to warm their hands, relax their muscles, breathe in a different way. And then I learned you could actually change your brain waves. And I'm like, well, how exciting is that? But first you have to look at what they are before you go about changing them. So we'll talk about neurofeedback, also a couple of newer treatments, transcranial magnetic stimulation, where we can use powerful magnets to stimulate or calm down certain areas of the brain that we see are overactive or underactive on scans. And what has really become one of my favorite go-to therapies, which is hyperbaric oxygen. And I was introduced to that by Mike Usler, who's a nuclear medicine doctor at UCLA. He'd been doing SPECT scans actually longer than me. And he's like, look at these scans before and after hyperbaric oxygen. It increases blood flow to the brain. We'll talk about medications to reduce aggression, self-injury, hyperactivity, mood disorders. Both Jerry and I mean, we're physicians. We're not opposed to medicine. We're just opposed to the indiscriminate use of medicine. So many of the kids you see and I see, they come to us on multiple medications that are not effective. Right. And, if it doesn't work, stop it. So often a medicine doesn't work and they'll start adding to it. It's not rational. We'll also talk about marijuana, and I think we have, maybe some differing views on it, but it's a very exciting area of research, but the scans I do give me some caution. So we'll talk about that.
And then we're going to go into behavior management and therapy techniques, whether that be applied behavioral analysis, what's known as ABA therapy. We could talk about how we can manage aggression and the acting out behaviors. Those are going to be, I think, a little bit better controlled with natural supplements that will augment what our therapists need to do, trying to get the kids to participate in breathing and exercises and putting themselves in a quiet place. That doesn't work with autism. I mean, it sounds great, and that might work for adults, but with the kids on the spectrum, that can be challenging. And then the kids, especially when they get older, they can have depression, and it's really sad when the children are coming out of this autism spectrum and they know that they're totally different than their peer group, and they don't know why this has happened to them. And it's hard enough for neurotypical adolescents to manage this period, let alone our kids who are on the spectrum and high functioning.
And they may want relationships and have really a hard time connecting, and so they get depressed, or they get lonely, or they get angry.
Just like neurotypical, except they have an extra impediment involved in this this thing that we call autism, because they do act out a little bit differently. They do see things in a very unique and special way, but it might not be valued by other people at this stage.
And so many people think of ABA therapy as the primary treatment for autism. And I think both Jerry and I think it's so much more effective if you put the brain in a healing environment and you optimize the biomedical pathways before you do ABA therapy. I mean, it can be incredibly helpful. I always say, it's better to do therapy with a brain that works right rather than one that won't remember or that misfires. We're going to talk about something that's really important, the transition to adulthood and a roadmap to independence. And obviously, the sooner you start, the better it is. But what I've discovered is it's really never too late to intervene. So start wherever you are at. We'll talk a little bit about dating relationships and independent living.
And, caregiver burnout, and you kind of alluded to that when you mentioned that the parents may have some traits that might be on the autism spectrum. But, when you're dealing with children who are up all night, or children who are not progressing the way you want them to be, maybe a spouse who's not as quite as into it as you might be, I think that these adults now, the parents that I also take care of, the joke was when we were in residency, when you're a pediatrician, you get your patient, but you also get two adults with that patient. They can have anxiety. They can have, we kind of joke, post-traumatic stress disorder. And it's like these parents wish it was post-traumatic because that means it happened in the past and it's over with. This is ongoing traumatic stress. And they too need to take care of themselves. And you've probably seen this where they want to pour everything into the child, but they don't take care of themselves. And I end up having to take care of them as well because of the anxiety, the sleeplessness, the constant worry, the depression. And if they have that genetic predisposition in the family to go that route, all you need is a child on the spectrum. And boy, you push them into that arena real quick. So we're going to talk about that as well.
Well, and one of the biggest issues I've seen with parents of autistic kids is grief. That they are really mourning the loss of what could have been, should have been, and it just goes on and on. And so learning to accept it, come to grips with it, do the things you can for it, and then make sure you're taking care of yourself and taking care of your relationship. When you have a sick child of any form, the incidence of divorce goes way up because of the chronic stress. And a lot of guys will go, well, I had a wife, I had a partner, I had a lover, and all of a sudden she's gone because all of her energy is into the child. And that's not a good strategy, because when the families break up, then there's a lot more stress, and you can't share the stress in the same way. So we'll talk a little bit about that as well. And then we'll talk about hope for the future and next steps. I'm so excited about the progress that has been made about how to optimize their brains and their bodies so they have the best chances of success. So stay with us. We're going to dive into autistic spectrum disorders, what they are, what they look like, a little bit of the history. We hope you find this incredibly valuable.